Good evening, everyone. My name is Catrese Coston, and I want to discuss the importance of stem cell research. I want you to sit back and think. If you or a loved one had a disease that could be cured, or if your quality of life could be enhanced by utilizing stem cell research technology, wouldn't you want the option of stem cell research therapy to be available to save or to enhance your life or the lives of your family members and friends? Do you know someone who is suffering from leukemia or lymphoma? Stem cell procedures can provide life-saving treatments to patients suffering from leukemia and lymphoma. I want to discuss what stem cells are, the classes of stem cells, some diseases that stem cell therapy can cure or prevent, and also discuss the controversy and ethical issues surrounding stem cell research. Let me begin by explaining what stem cells are. According to the American Medical Association, a stem cell is an immature cell that has the potential to specialize into different types of cells throughout the body. The cells serve as sort of a repair system to the body. The basic types of stem cells are adult stem cells, which amazingly can be found in infants and children, and are found already in developed tissue. They act like a repair system and can be found in the brain, muscle, bone, skin, and blood. The other basic stem cell type is embryonic stem cells that are produced when a newly fertilized egg begins to divide. These cells can become any type of cell in the body. The two classes of stem cells are pluripotent and multipotent cells. According to the National Institute of Health, pluripotent cells can differentiate into almost any cell in the body. Multipotent cells can differentiate into several types of cells and have been found in cardiac cells and bone marrow. Stem cell research is important from a medical perspective. According to the American Medical Association, stem cell technology has been used for over 20 years in bone marrow transplants in order to produce new white blood cells to replace abnormal cells. Research is being conducted to see how stem cells can be used to prevent or cure Parkinson's disease, heart disease, type 1 diabetes, spinal cord injuries, strokes, burns, osteoarthritis, and rheumatoid arthritis, vision, and hearing loss. I now have a better understanding for the need of stem cell usage. Do you have a better understanding of why stem cell usage is important? How are the cells being used today? Stem cell procedures currently provide life-saving treatment for people suffering from leukemia and lymphoma and other blood disorders. My best friend, who shared the same first name that I have, lost her battle to lymphoma at the age of 40. This is a picture of her. Her name was Catrese Bergeron. She suffered from this disease, and it was hard to see her battling with this disease. But with technology and with all the research being done, it would be wonderful if she could have benefited from life-saving treatment from the use of stem cell research and technology. Researchers and doctors better understand diseases and how conditions develop through the use of stem cell technology and research. Have you ever heard of regenerative medicine? Regenerative medicine is where cells can be guided into specific cells to regenerate and repair diseased and damaged tissues. Testing new drugs for safety and effectiveness. Before using new drugs on people, Stem cells are useful in testing the safety and quality of investigational drugs. Now let me talk about the three main stem cell technologies in use today. Adult stem cell transplants, bone marrow cells, which I mentioned earlier, is one of them. Adult stem cell transplants, peripheral blood stem cells, or PBSCs as they are known, which are sparse in the bloodstream, are obtained from drawn blood and are easier to collect than bone marrow. Umbilical cord stem cell transplant, which are useful in treating the same types of health problems as those treated with bone marrow and PBSCs. That's where the debate comes into play over the use of embryonic stem cells. Have you ever thought about becoming a stem cell donor? If you want to become a donor, usually people can volunteer to become a donor, and they do this because they want to help a family member or friend or other loved one who needs a match, or they just want to be helpful. They just want to give the gift of life to someone. Testing and education are conducted for the donor. If you're considering becoming a donor, you can inform your personal physician of your desire to become a donor or volunteer and join a registry. Now let me talk about ethical issues and research surrounding stem cell research and technology. Religious views. Because certain religions oppose embryonic stem cell research. They do this and they oppose it because they believe that human life begins at fertilization. According to an article by Medical News Today, in the United States, it isn't illegal to work with or create embryonic stem cell lines. The big debate, however, in the United States is about funding. It is illegal for federal funds to be used to research stem cell lines that were created after August of 2001. The National Institute of Health created the guidelines for human stem cell research in 2009. These guidelines defined how embryonic stem cells are used for research and how these cells are to be donated. Now, you know the importance of stem cell research and how it can potentially save or enhance the quality of someone's life. I think stem cell research is important, and hopefully you think this research is important as well. I've explained what stem cells are, different classes of stem cells, diseases that stem cell transplant therapy can cure or prevent. I've also discussed ethical issues and controversy surrounding the use of stem cell research. And even after learning about these things, I still sit back and I say to myself, if I were sick, if I were ill, if I had a life-threatening disease or condition, wouldn't I want someone to help me? And the answer is yes. I would want someone to help me. And if I was in a position that I could help someone who was suffering, who had an illness or a disease, if I had something in my body that could help aid that person to be cured or have a better quality of life, yes, I would do what I could to help them as well. That's why I think stem cell research therapy is important, and hopefully you'll think it's important as well. If you or a loved one were dying or had a disease that could be cured, ask the question to yourself, wouldn't you want to have the option to live, to be cured of the disease, or to have a better quality of life? If you had to live with the disease and there was no cure, I wouldn't give it a second thought. Before making a decision, put yourself in that person's shoes. Just sit back and think. Can you donate a gift to help someone who may be suffering? Wouldn't you want to help someone a family member, a friend. When you sit back and you think about these things and you think about the amazing things that stem cell research and therapy and technology is able to do, then if I were you, I would say yes. I would want to be able to donate the gift of life to someone. Hopefully, after this speech, you will sit back and think about the things that I discussed today. And you will answer the question just like I answered it. Yes, if I was in that position, I would want someone to have empathy for me. And I would want them to give me and assist me with donating something to help me with the gift of life. Thank you. I hope you enjoyed my speech. I hope you learned something today. And I hope that this persuades you and others to become donors for stem cell research and other transplants to help someone to save a life.